Hi, everyone. I'm Madison Mills, a reporter at Quick Take with Bloomberg News. I'm joined here today by Miami Mayor Francis Suarez to talk about the rise in COVID-19 cases across the state of Florida, and specifically in Miami. For those of you watching at home, please comment with any questions you have for the mayor, and we're going to be looking at these comments throughout our chat, and I'll get to as many of those questions as I can. Mr. Mayor, I want to start off by just asking how you're feeling. You were one of the first elected officials in the U.S. to have coronavirus, so how are you holding up?
I'm holding up well. I mean, obviously, I was in quarantine for 18 days, and then, having to deal with the remainder of this pandemic, which is still ongoing, and unfortunately, seeing the uptick that we're seeing now, which is extremely alarming and concerning. And then, of course, dealing with the protests that all cities are dealing with in the United States has really created a lot of challenges for cities across the country.
Absolutely. And in terms of your symptoms, are you feeling okay? I know you've got a lot on your plate, but are you feeling well?
All things considered. Yeah, no, I've tested multiple times. I've done a lot of antibody tests and a lot of antigen tests. And ever since I tested negative in day 18, I have not tested positive again. And I've had, antibody tests that I've taken that have indicated that I still have antibodies for COVID.
Well, that is great news. We're going to get into all of the topics that you mentioned. I do want to start out by talking about the rise in COVID-19 cases, particularly in your backyard. What do you attribute this rise to?
It's hard to say. We opened we're the last city that opened in the state of Florida. So we basically lagged behind Miami-Dade, Broward, and Palm Beach counties, which lagged behind the entire state. And I think for us, we start to see the data shift after we opened up restaurants, which was in phase 2 or phase 1B. Once we opened up restaurants and we had Memorial Day weekend, we started seeing a shift in the data with the protests, that have been happening for the last 2.5 weeks. We also have seen a shift in the data. And the data has shifted on basically every single metric with the exception of deaths. We've seen an uptick in new cases. We've seen an uptick in new influenza-like reporting. We've seen an uptick, a significant increase in percent positive, which is a percentage of people that are positive. We've seen an uptick on hospitalizations, ventilators, and ICU beds. Thankfully, nothing that risks our total capacity, which is still at about 50% of the total. But these are all alarming statistics, particularly because they can influence the one that's the most important, which is deaths, which we have not seen so far upticking. But we know that there's a lag between 4 to 5 weeks from new cases to when, unfortunately, the evolution of this disease can result in death. So we're very carefully monitoring that.
Absolutely. And you mentioned hospitals. ICU beds in Homestead are completely full now, and as you said, rising across the state. What will you do to ensure that hospitals aren't experiencing too much of a surge?
We have excess capacity through surgical centers, through portable hospitals that we have at our disposal. We do have a surge in Homestead, without a doubt. But system-wide, county-wide, we still have significant capacity. And so I'm sure we can shift resources from hospital to hospital if need be. But the truth of the matter is that is the critical firewall figure. If our hospitals become overburdened, that's when you see the death rates across the world and across the country elevate to levels that are unacceptable.
Absolutely. And you use the phrase critical figure. What critical figures are you looking at when thinking through whether, bars need to close again, whether beaches should maybe not be opened as much as they are right now?
Well, we decided not to open bars. We have some restaurants that act like bars, but and we have to police that and crack down on that. And we have, but we have decided not to go into what we call phase 3, which is opening up of bars, movie theaters, nightclubs, and large coliseums and stadiums, large congregations of people. So that's a decision we did 2 weeks ago. We have not wavered on that, and we just implemented a new rule that you have to wear a mask in public. We're doing everything that we can not to paralyze businesses which have had such a hard time getting going, but at the same time doing everything that we can to protect our residents.
Of course, and I'm wondering what systems are in place for, as you mentioned, restaurants that might be acting like bars and potentially not following CDC guidelines and guidelines along social distancing. What are you doing to track that and encourage them to act differently?
We have a task force that is out there checking bars. We've done thousands of inspections. And listen, we also get a ton of complaints from residents directly to me. We get complaints through social media, and we investigate those complaints. And we've already shut down 5 businesses just last weekend alone. And we're going to continue to do that if we have to.
And you mentioned the mask mandate as well, which is new in the area. What are you doing to enforce that and to make sure that all residents have access to masks?
Well, the first thing is, we understand that whenever you implement something that's so broad, right, like mask in public for everyone or like stay-at-home orders, it's going to be impossible to enforce. I mean, we didn't go house to house to make sure people were home. We implement these rules because most people are law-abiding. They want to follow the rules, and we want to make sure that we have a clear set of rules based on what we think is best for our residents to protect themselves. Now, there are going to be some that don't follow those rules, and for that, we have the ability to ticket them, and we have the ability to, in theory, arrest them if they were systematic violators, although we're hoping that it doesn't come to that for obvious reasons. What we want to do is educate people. We want people to comply, not so that we want to penalize them or shame them in any way. What we want to do is make sure that they're taking care of themselves and others.
Absolutely. And the data shows that young people in particular across the state are getting the virus in droves right now. I'm wondering if that changes your thinking in terms of any guidelines you might want to put forth specifically related to activities young people may be more likely to do.
Yeah, we're monitoring that because the concern is that even though it is young people that are predominantly getting sick, and even though they are and oftentimes asymptomatic or may not need as much critical hospital care, they live in many cases with their parents, with their grandparents, and that is a vulnerable population that we're worried could contract the virus, which has a much, much higher mortality rate than the flu. I think it's a 4 or 5x in numbers that I've seen, in statistics that I've seen. So we have to do everything that we can to make sure that those in that community understand how serious this is and how it can affect not only them, but their family members.
Absolutely. And are there any specifics about, especially in the state of Florida where we do have a lot of at-risk populations? I'm here in Tampa with some elder relatives as well. What can be done to keep those relatives who are at risk a little safer?
Well, we recommend that they stay home. We recommend if they can that they stay home. That what we have seen in terms of our statistics is that the stay-at-home order was the most effective way of curving, of stopping the spike and of flattening the curve, as they say, and actually reversing the trajectory of the increase. So staying at home is obviously the most effective way. But if you can't do that, then obviously follow all the rules. Social distance, wash your hands, try to avoid touching your face, and of course wear a mask whenever possible.
And I want to remind our audience watching as well to please comment with any questions you have for the mayor, and I will ask as many of those as I can. I'm wondering if you can talk a little bit about pro sports across the state. Do you envision any sporting happening in the fall? And if so, what will be done to keep viewers safe?
Well, it looks like basketball is about ready to resume in Orlando. There's been some discussions based on the spike as to whether or not they're going to start, but it looks like they're going to start in a self-contained campus. Where the basketball players will be playing without fans. It appears that baseball may have reached an agreement to start as well, and I presume that will be without fans. What will be interesting to see is whether football begins as scheduled in August and whether there are any fans. I don't think that in Miami-Dade County there are, right now, it's going to be allowed for the football teams to have fans. I know that the county mayor has indicated that he would like to see a plan from the team if they desire to have some percentage of fans in the stadium. But I think with the recent spike, my guess is over the last 2 weeks is that that's talk those were things that were said that a couple of weeks ago. I can't imagine that would still hold true now.
Absolutely. And you mentioned the success of the initial stay-at-home order. What will it take to have officials like yourself reconsider another stay-at-home order in the state? And is that something you're already thinking about?
It's something that we can't take off the table, but it's something that we should only use in a last resort. And the reason why is because our economy is not where it was when we implemented the stay-at-home order. We had full employment at the time. Now we have historic levels of unemployment. Those who are employed are making a fraction of what they were making. And so it's a more dramatic time to implement something that dramatic, that drastic. And so, I think it's a measure of last resort. I think it would only happen if it became apparent that our hospital system was under siege and that our death rate could continue to climb to continue unacceptable rates. That would be the time when we would consider doing something like that again.
Sure. And I understand you mentioning the economic situation that we're all in, but what would you say to citizens who think that we were previously in a less dramatic situation when you already had the stay-at-home order in place because rates were lower? What would you say to them?
I'd say they're right. I'd say they're accurate. When we implemented the stay-at-home order on March 24th, the high water mark for new cases was 533 in Miami-Dade County and 1,300 approximately in the state of Florida. We just hit 5,400 in the state of Florida, which is 4 times greater than the high water mark. And we hit slightly over 900 in Miami-Dade County, which is almost twice the high water mark. It's completely understandable that people would say, why aren't you implementing a stay-at-home order now when you're double the number of new cases than you were back then? I think there was a lot less known about COVID at the time. And so I think, they were done as a prophylactic measure. And obviously with the objective of completely shutting down the virus. And I think, unfortunately, now we're in a position where we've seen when we don't act in conformity with the rules, how quickly the virus spreads, which is something that I said all along when we started opening.
And so your message would be, it sounds like, more focus on following the rules in place before you issue that stay-at-home order again.
Yeah, my message is let's wear the mask in public. Let's see if that will help, again, flatten the curve once again. Let's understand that we cannot be in large congregations of people, which we're seeing in some of our restaurants, and that we will shut down those restaurants. And even when you're in the beaches, you have to avoid being in large congregations of people or in close proximity with people.
And speaking of beaches, something all Floridians hold dear to their hearts. What would you do? Would you consider closing some beaches in order to keep restaurants and places that are spurring the economy open?
Yeah, look, the mayor of Miami Beach is the one that would make that call in conjunction with Miami-Dade County Mayor. I actually supported him when he decided not to open up the beaches when the rest of the state of Florida opened. He actually waited until early June, past Memorial Day, and I thought that was a wise decision. Having said that, and that may be part of the reason why our spike is half as intense as the rest of the state of Florida. It's a call that he has to make. I would support him if he decided at some point that he wanted to close the beaches again. But that's going to be a tough call as well.
Absolutely. And in terms of leadership in the area, I wonder if, this is obviously an unprecedented time. Are you considering kind of going above and beyond the powers that you may have utilized in the past as mayor to enact any more drastic changes to keep your residents safe?
It's funny because I get a lot of blowback from the powers that I already exercise. I have, when we implemented the mask ordinance, it wasn't like universally embraced as a great thing. I think we're even actually being sued. I'm not sure if the city or the county is being sued for the mass implementation ordinance. So, when we do things, there are a segment of our population that thinks that we're curtailing their freedoms, and we're not doing it for that reason. I mean, certainly that's not our objective. Our objective is just to keep people safe and do what we think is best for society as a whole. But there are people that don't like it and that are critical of the already broad powers that we've exercised during this crisis.
And what do you make of residents rebuffing the mask mandate?
I don't think it's a good idea. I don't think it's good for their health. I don't think it's good for the health of others. And that's why we implemented it. And they also have to understand is that we can't ignore the evidence that we're seeing, the data. It's our objective to, number one, be transparent when we see data that is unfavorable. And number two, to give recommendations and create mandates that are keeping people safe. So if they don't follow them, the only thing that they're doing is risking themselves and their family members. And so I don't understand the logic behind that.
And I want to go to a question from our audience. A commenter said, what is the plan with reopening office buildings, and how can we ensure that companies will keep employees safe? I think this is something on a lot of people's minds as certain offices reopen.
Well, offices are open. They're open. They have some capacity limitations. I would highly recommend that you wear a mask inside, because if somebody comes to the office infected, it could easily be an area where it could be spread. Wearing a mask indoors is something that is a requirement in the city. And so, but a lot of people are also working virtually more than ever. And that's an interesting dynamic that has been as a result of COVID, and has really forced companies to really rethink how they do business.
And in terms of rising numbers of people gathering in one place, Miami is going to host the presidential debate between Biden and Trump. How is that going to work, and how are you going to keep attendees safe if you plan on allowing people to attend?
Well, first of all, I'd say mid-October, so that's that's still a good 4 months away approximately. And so we don't know exactly where we're going to be in the next 4 months. Right now, we're not in phase 3, so you cannot have an event like that with people in the audience. So right now, and look, and I know the press has gotten accustomed to, and TV has gotten accustomed to doing things audience less and remotely. So it's very possible that the debate could be had without audience members if things do not change, or if things get better, then there's a possibility that we could be in phase 3 by then, and there will be some other sets of restrictions.
And alongside the debate, do you envision any rallies or protests similar to the ones we've seen now popping up around that time that could cause concern? I'm
sure they will, and I'm sure they will. and I say that because I'm sure the protesters will be there, and I'm sure that it will create concern, because it's impossible not to link right now some of the elevating numbers in Miami to the fact that we had thousands of people in our streets congregated closely together for 2 consecutive weeks, 3 consecutive weekends. So that's certainly going to be a concern. You can see in the infographic that you're displaying, some people wearing masks, but a lot of people not wearing masks. So that's definitely a concern.
Absolutely. And I think some constituents would maybe push back on that and say that folks are also not wearing masks at the beach, right? So I wonder what your thoughts might be on instituting further guidelines for beaches and pools and things like that.
I think that's a legitimate, certainly a legitimate response and criticism. And again, I'm willing to work with the mayor of the beach to support his desire to do that if that's something that he wants to do.
And another common occurrence in the state of Florida is hurricanes. I grew up experiencing many of them. We're already in a pandemic. What's going to happen to Floridians if they also experience a hurricane at this time? And what's your plan for that?
Well, the good news is that we're a city that's, obviously that prepares for hurricanes and understands what a hurricane is. And, we have a lot of experience dealing with hurricanes. We're hopeful that this year we get spared given everything that we've had to deal with. But it wouldn't be surprised, given the nature of the year that we've had, that we would have a hurricane. So we'll be ready. The city is preparing itself as it would any normal year, with the exception that we obviously have to have additional protocols for COVID. COVID issues related to how we prepare and how we are prepared for that hurricane.
Absolutely. And as we head into the fall and the winter, more folks from up north may continue to come down to the state of Florida. How are you planning to handle travelers to the city?
We have, the state of Florida has a requirement that if you come from the state of New York, you have to quarantine for 14 days. That so far hasn't changed as far as I know from any other states, but certainly it is additional, makes things a little bit more challenging when you're not only trying to keep the residents who are here safe, but you now have to keep residents that come from outside and maybe even areas that have higher incidence of COVID into our community.
And I want to remind our audience watching that we are joined by Miami Mayor Francis Suarez talking about the rise in COVID-19 cases across the state of Florida. If you have any questions for the mayor, you can comment them and I will ask as many as I can. I'm wondering how you are handling social distancing and what that experience has been like for you.
It's been very difficult. I can tell you as mayor, first of all, having had COVID, you come out 18 days later and you're in a different world. And so it's still taking me, I'm adjusting to it. The other day I was at a restaurant where I was able to, have, not have my mask on, but somebody came and took a picture of me and the picture went viral. And I wasn't wearing a mask. So, it's an adjustment for me as well. Part of it is an adjustment because I had COVID. The other part of it is an adjustment because I'm the mayor and people want to get close to me. And the third part is I'm supposed to be an example. And so if I'm asking people to wear masks, I have to, I obviously have to act the way that I ask people to act as well. So it's an adjustment for me and something that, I have to continually remind myself of. We live in a world where we're constantly on the go. Sometimes you get up in the morning and you're going out the door and you realize, hey, you got to get your mask on. It's something I'm a human being. I'm not perfect. And I'm not asking my residents to be perfect either, to be frank with you. What I want my residents to do is just take care of themselves and to do the very best that they can.
And what about residents who are looking to their officials and feeling like they've failed them at, the federal and the local level because these cases have gone so much higher, particularly in Florida? What do you say to them?
Well, look, I say, we're doing the best that we can given the things that we're trying to balance. We're trying to balance the fact that, when we started this, our economy was in shambles or was doing great. And then, quickly went into shambles. We were one of the states and the cities that had handled it very well in comparison with other cities in the U.S. But I think now what we're seeing is as we've opened up, is we're seeing the kind of behavior that leads to a quick increase, and we have to stop that immediately.
Absolutely. And another audience question we have, is it a challenge that every state seems to have a different reopening strategy and some are more strict than others? And I'm wondering, you can talk about that even at a more hyper-local level.
Yeah. Look, I think it's really hard to have a one-size-fits-all strategy. I'll give you an example just from Miami-Dade County, as you're saying. Miami-Dade County has 34 different municipalities. The city of Miami is the largest one. It's extremely dense. It's a metropolitan city. You can't treat that the same as a city that is a very small city and a suburb city. You also can't treat Miami the same as Ocala, for example. So they're just totally different circumstances, and they need to be dealt with in a very different way. Which is why we, as a city, were the last city to open in the entire state of Florida, because we just felt like we were not ready.
Absolutely. And we have another audience question from Twitter. User asks, will school schedules change? Will they be dispersed at all to allow for parents who are having to work from home to safely drop their kids off at school? What thoughts do you have on school changing back in the fall?
I haven't had a chance to speak to the superintendent yet. I know he's about to unveil his fall plan soon. And so I would tell your audience members to look out for that. That should be coming out. I was told it was going to come out today. But if not, it should be coming out sometime this week. And I'm going to be reaching out to him as well to get a briefing to see what's going on. But it's incredibly challenging times right now. And it's it's hard to put it out there because the ball is moving so much. I mean, just 2 weeks ago, we were still seeing numbers decline. And now all of a sudden, in 2 weeks, we're seeing a rapid increase.
Absolutely. And another thing that we're seeing right now alongside COVID-19 is a groundswell of protests surrounding the killing of George Floyd and Black Lives Matter protests popping up in all 50 states. How are you responding to protesters, and what is your plan to keep constituents safe and address issues of police brutality in your municipality?
The first thing we're doing is we're listening. We're letting people protest, understanding that there's a tremendous amount of disgust over the incident that occurred, not just in Minneapolis, but so many incidents that have happened across the country. We're looking at our internal policies. We've made a lot of reforms over the years because we've unfortunately had our own incidents of officer-involved shootings. I had to fire a police chief when I was a commissioner. I had to cast a deciding vote to fire him because he had policies that led to the killing of 7 African Americans in 1 year in the city of Miami. I also helped fully fund the civilian investigative panel when I was a commissioner so that we could have civilian oversight over our police department. Our current chief has dismissed more officers than the last 3 chiefs combined, which I think is important to have accountability. But I also think we have to continue to look at implicit bias training to see if we're doing enough of that. How are we disciplining and getting rid of officers who continue to rack up use of force complaints? Our use of force complaints are actually down, even though we have more officers than we've had in our history. So, and also it's important to look at what are our officers doing that maybe they shouldn't be doing in terms of, so many different calls for service of whether it's mental health, acting as social workers. We want our officers, our police officers, to handle what they know how to do and let other professionals handle cases that they may not be equipped to handle.
And how are you thinking about arrests for protesters and alongside COVID-19? Also, I'm wondering if you could address the Muslim woman who was asked to remove her hijab, or forced rather to remove her hijab when she was arrested while protesting.
Yeah, I think there's two things. The woman who was asked to, that was Miami-Dade County in the corrections department that asked her to remove her hijab. And I think my understanding of it, and I'm not, I think that, she should be respected in terms of, her religious identity and how she practices her faith. And I think we have to be very, very sensitive and very careful to not infringe on the way people exercise their faith. And so I think it's something that, we need to look at and see if we can get the same type of information without insulting someone or infringing on their religious freedoms. That's something that we should seriously consider.
Absolutely. And the question of keeping protesters safe if they are arrested.
Yeah, and we had very few arrests. Again, we've been very fortunate throughout this entire protest. We had very few arrests. I think we had 7 arrests in one incident where there were some statues that were being defaced. I think we had 3 arrests on the first Sunday and 50 arrests the first Saturday. I think most of those arrests on Saturday were dismissed because there were curfew violations. So we've had very few arrests. We've tried to avoid confrontations. We've let the protesters have space, and we've blocked traffic for them. In fact, I've been criticized at times for quote unquote being too soft on the protesters. I don't agree with that. I think our department has done a magnificent job of being disciplined, of not unnecessarily being provocative, and I think because of that, we've gotten some positive national attention.
Absolutely. And thank you so much for sharing so much time with us today. We do have only a couple minutes left, but I wanted to give you the time if you have any other messages you want to get across to our viewers about how you're handling COVID-19 and how you're doing. I
want to tell your viewers and our residents that we cannot do this without you. We have to do this together. This is something that this is a fight that we have to join each other in. We're not here to shame people. We're not here to insult people. What we're here to do is to collaborate with our brothers and sisters in our community and make sure that we're doing everything we can to keep each other safe.
Absolutely. Well, thank you so much, Mr. Mayor, for making time for us today. We so appreciate it. And thank you to everyone watching. Please follow Quick Take by Bloomberg on all social platforms: Facebook, YouTube, Twitter, Instagram. And thank you again for watching.